The College of Medicine at the University of Saskatchewan is dedicated to social accountability and to meeting the health needs of the communities it serves.
The Association of Faculties of Medicine in Canada in 2001 developed a position paper on social accountability that I think applies to all of the medical schools in Canada. But the college here has a special relationship to it. The first dean, Dr. Wendell McLeod, actually introduced social medicine as a department of one of the first departments in all of Canada. And it just resonates very well with who we are as a province, the creation of Medicare and other aspects of social accountability.
CARE is a description of what we do at a College of Medicine: clinical activity, advocacy, research, education, and training. So we use that both to give us a sense of just what it is the work of our college is, as well as to look at in what ways are we a caring college, in what ways are we integrating social accountability into all of the work that we do.
One of the ways the college does this is through the Making the Links program.
Making the Links is a multi-site experience that takes students to Northern Saskatchewan, has them work at the student-run clinic of Switch, and then takes them to rural Africa in Mozambique in sub-Saharan Africa. And through that experience, they get exposure to the social determinants of health. They get exposure to the experience of marginalized populations in multiple settings.
All students participating in the program volunteer for shifts at the student-run clinic Switch in inner-city Saskatoon. The clinic offers out-of-hours services to marginalized communities.
Switch is the student wellness initiative toward community health. One of only 5 student-managed, completely student-managed primary health care centers in Canada. One of the whole points of Switch is to provide students a glimpse of how the social determinants affect a person's health. Most of our clients are either low or no income. Many of them are on social assistance. Many of them are of First Nations and Métis background, and many of them just face some bigger issues and challenges around their own health care than other people in other parts of the city.
It's an interprofessional program where you have physicians, nurses, and pharmacists all working together to try and address the patient as a whole.
At the end of their first year, students in the Making the Links program spend time with communities in a rural setting.
In Northern Saskatchewan, the students spend 6 weeks either in the Métis community of Isle Cross or on reserve at Buffalo River Dene Nation, also known as Dillon. During that period, they do a lot of community work. They work with different organizations that are offering health education services in the community. They work a lot with youth around mental health, around sexual health, and other issues facing youth in the community. They also do a certain amount of clinical time working at the local clinic with doctors.
I get to walk the life that these patients live, and so I can better understand where they're coming from. A patient may come to you talking about how, their living condition is not very good, and there's multiple families living in a house, but until you actually live there and go up to Dillon and live in a house where you have a couple families living in a house, and that, the power is off and on here and there when it rains, you don't actually see what it's like until you live there.
At the end of their second year, students visit a community in Mozambique.
They make do with a lot less than we have here, and there could be ways that we could look to that as a way to learn. It helps me appreciate what our medical system has. The most important thing I've learned from Making the Links is how to connect with people who come from completely different backgrounds, understanding where people come from and not making assumptions about where people come from. So it was an inspirational experience overall.
If we get to the patient-centered care model that we all talk about, this is exactly how it will happen, because the students have been probably the major force of change, if you will. I really do believe that we're making substantial progress in changing a system and is meeting the needs of all Canadians for health care.